Okay, let's yap about the endometriosis mapping ultrasound. This is a very important part of my practice, as well as the other surgeons in SE. And this is for a number of reasons. An ultrasound performed by the surgeon allows the surgeon to essentially paint a picture of what the patient's pelvis is going to look like before surgery. That means I can better counsel you. I can better explain what we might encounter at the time of surgery. I can better plan for the surgeons that I will need at the time of surgery. And usually, a follow up question that I get for that is, well, what makes it different? What makes it different than the usual pelvic ultrasound? So the mapping, well, let's start with what a typical pelvic ultrasound entails. So typical pelvic ultrasound, they will probably start with a transabdominal view, take some images there, and then they'll move to a transvaginal portion, which is where the wand is inserted inside. And they're going to measure a couple of things. They're going to measure the uterus, length, height, and width. They're going to measure the ovaries, length, height, and width. They are going to measure the thickness of the endometrium. They can comment on any fibroids that might be seen in the myometrium. They can comment on any cysts that might be seen in the ovaries. And certainly there could be other details that may apply in certain circumstances, but that's kind of the basic gist that you get. On top of that, so in the mapping ultrasound, we do all of that, plus we look at some additional things. Okay, we're going to be seeing if the uterus slides in relationship to the organs that are surrounding it. So we'll look and see, does it slide or move freely in relation to the bowel, in relation to the bladder? We are going to be looking at the bowel wall to see, does the bowel wall look to be thickened by anything? Does it look like there's a lesion in the bowel wall that could be concerning for either endometriosis that's deeply infiltrating or scar tissue? We are going to be looking very closely at the muscular layer of the uterus to see, do we see any of the sonographic findings that we commonly see in the setting of adenomyosis? And there's a whole published list of those. They're actually called the MUSA criteria, and I can link the paper in the caption so you can take a look at it. So we're looking very closely to see, do we see signs of adenomyosis? We can look to see if the ovaries move freely in relationship to the uterus and the surrounding structures. We can look at the bladder wall to see if that is thickened, okay? If we want to go outside of the pelvis, we can use ultrasound to look in many other different areas. We can use it to look in the right lower quadrant in the area of where the appendix may be. We can use ultrasound to scan through the whole rectosigmoid colon, not just the rectosigmoid colon that's located just behind and up to the top of the uterus, but we can continue using ultrasound on the abdomen to scan that area. We can also use ultrasound to look in the right upper quadrant where the liver would be and where the diaphragm is. Now, typically, a MRI would be the best study to determine if there would be endometriosis in that area, although MRI can miss diaphragmatic endometriosis, but ultrasound is yet another tool that we can use. So you can see how the mapping ultrasound can get quite complex, very detailed, but really it's to the benefit of the surgeon who's going to be performing the surgery to be able to best counsel the patient, to be able to best plan for surgery and to have the right people there. And then all of these benefits ultimately benefit the patient so that you are aware of what you're getting into, what we can do when we encounter those surgical situations. These are things that we can go into discussions about so that you're prepared and you know what to expect. And really just helps us plan for the best surgical outcome. And so I love the fact that I do my own ultrasounds and can use that information in real time to counsel the patients and just make an excellent plan for an optimal surgery. So let me know if you have any questions about the mapping ultrasound. Please share this, like, and give me a follow.